Hello, my name is Stacy Whitehurst, an MLT, currently working at New Hanover Hospital, and a student at Winston-Salem University, currently in the CLS program. Today, we are going to talk about personalized platelet transfusions in rare blood disorders, tailoring treatments for improved outcomes. Patients with rare blood disorders often encounter significant challenges when receiving platelet transfusions. Standard platelet transfusion protocols currently in use do not consider individual variations in platelet functions and genetic factors. These variations can significantly impact the effectiveness and safety of platelet transfusions. Consequently, some patients may experience adverse reactions, ineffective responses to transfusions, leading to suboptimal clinical outcomes. There exists a pressing need to explore the potential benefits of customizing platelet transfusions based on individual patients' unique platelet functions and genetic profile. This personalized approach holds great promise for improving patient outcomes, enhancing the overall effectiveness of platelet transfusions, and minimizing the adverse reactions. This research aims to investigate the profound impact of personalized platelet transfusions and transfusion outcomes, clinical response in patients with rare blood disorders. It also dives into the potential use of genetic markers to identify individuals of higher risk of adverse reactions or ineffective responses. Our study is committed to implementing tailored transfusions based on individual patients' platelet functions or genetic markers, with the ultimate goal of improving the patient's outcome and reducing transfusion-related adverse reactions. However, it is important to acknowledge and address the inherent limitations and challenges associated with customizing transfusions based on individual genetic markers. Patients with rare blood disorders encounter significant challenges when it comes to receiving effective and safe platelet transfusions. Standardized platelet transfusion protocols, while widely used, often fall short in addressing the unique needs of individuals with these disorders. Key challenges include variable response rates. Standard protocols do not account for individual limitations in platelet functions, leading to variable response rate among patients. Adverse reactions. Some patients may experience adverse reactions to platelet transfusions due to the lack of customization in these protocols. Ineffective responses. Ineffective responses due to transfusions can occur, resulting in suboptimal clinical outcomes. Frequent transfusions. Due to the limitation of transfusion protocols, patients may require frequent transfusions, which may impact the quality of life. Safety concerns. Safety concerns arise when transfusions are not tailored to the individual needs, potentially leading to complications. The limitations of standardized platelet protocols underscore the urgent need for more personalized approaches. Customized platelet transfusion offer the potential to address these challenges and significantly improve the outcome of these patients with rare blood disorders. Need for personalized approach. There is a compelling and critical need to transition to personalized platelet transfusion approaches in the management of rare blood disorders. The rationale for personalized approaches stems from the profound impact of individuals' variations in platelet functions and genetic transfusion outcomes. Platelet function can vary significantly among patients, affecting how affecting how effectively transfusion platelets contribute to clot formation. Some individuals may have platelets that are more or less responsive to transfusions, influencing the speed and quality of clot. These variations can result in variable transfusion outcomes, with some patients experiencing inadequate responses to standard platelet transfusions. Genetic factors play a pivotal role in determining how platelet functions and responses to transfusions. Significant genetic variations can make some patients more susceptible to adverse reactions, while others may experience reduced platelet recovery post-transfusion. The interplay between genetics and platelet function is complex, underscoring the need for tailored approaches. Failure to account for these individual variations can lead to suboptimal clinical responses, including ineffective hemostasis, increasing in the risk of bleeding episodes, adverse reactions such as transfusion-related acute lung injury or TRALI, or genetic or allergic reactions. The need for frequent high-volume transfusions potentially compromising patients' well-being. Customized platelet transfusions represent a transformative shift in addressing these individual variations and optimizing transfusion outcomes for patients with rare blood disorders. We reviewed existing literature on platelet transfusions, platelet function testing, and genetic markers in relation to transfusion outcomes in rare blood disorders. Focused on personalized platelet transfusions based on individual patients' platelet functions or genetics. Comprehensive analysis to identify gaps in research in this field. Up to 30% of patients receiving multiple transfusions may develop platelet-related alloantibodies, leading to platelet refractoriness. Fc gamma receptors play a role in immune-mediated destruction of transfused platelets. FCR genetic variations do not predict platelet refractory risk. Personalized platelets transfusion for immune thrombocytopenia. Personalized transfusions based on platelet function testing improve platelet recovery, reduce bleeding episodes, and transfusion needs. Non-compliance with guidelines for platelet transfusions in ITP patients resulted in higher risk and cost. Platelet function testing, including flow cytometry-based assays, aid in understanding platelet reaction transfusions. Flow cytometry-based testing helps determine optimal conditions and temperatures for platelet function analysis. Platelet function testing stability and variable assessed, providing valuable diagnostic insight. Rapid platelet function testing helps identify patients at risk of inadequate platelet response to transfusions. Platelet transfusions did not improve outcome in patients with platelet dysfunctions due to traumatic intracranial hemorrhage. Evidence suggests a need for restrictive platelet transfusion policy, focusing on the risk-adjusted approaches. Role of next-generation sequencing. NGS technology aids in blood group and platelet antigen genotyping, offering targeted sequencing and accurate results. Individual transfusion strategies based on platelet factors, including platelet dysfunction and clinical characteristics, efficiently prevent bleeding complications while minimizing unnecessary transfusions. Studies collectively support the evidence of personalized platelet transfusions based on genetic markers and platelet function testing in improving outcomes of patients with rare blood disorders. The comprehensive literature review provides the foundation of understanding the current state of research and highlights the potential benefits of personalized platelet transfusions in patients with rare blood disorders. Our research employs robust data analysis methods to extract valuable insight from the collective data. These methods are carefully chosen to ensure the comprehensive examination of the impact of personalized platelet transfusions in rare blood disorders. Descriptive statistics will be instrumental in summarizing the demographic and clinical characteristics of patients. This includes key information such as age, gender, diagnosis, and medical history. These statistics provide a clear snapshot of the patient popularity under study, enabling us to understand their profiles. We will employ statistical tests to assess the significance of difference between personalized platelet transfusions and standard platelet transfusion protocols. We may use t-test for continuous variables and the chi-square test for categorical variables. These tests will help us determine whether the observed differences in transfusion outcomes are statistically significant. Depending on the nature of our data, we may conduct regression or correlation analysis. Regression analysis will allow us to explore the relationship between multiple variables, such as genetic markers, platelet function tests results, and transfusion outcome. Correlation analysis will help identify potential associations between variables, providing insight into the factors influencing outcomes. To ensure the clarity of our findings, we will present data using variable visual aids. Tables will be utilized to present detailed information in an organized format. Graphs and figures will be employed to visually represent trends, patterns, and significant differences in more accessible manner. These visual aids are critical for conveying complex information effectively to both the scientific community and a broader audience. Our data analysis methods are meticulously selected to ensure the comprehensive examination of the impact of personalized platelet transfusions in rare blood disorders. The use of both descriptive statistics and advanced statistical tests, along with visual aid, will enable us to derive meaningful insight and contribute to the growing body of knowledge in personalized platelet transfusions strategies. Identifying specific genetic markers associated with platelet function and transfusion outcome is pivotal in understanding the underlying mechanism of platelet transfusion refractoriness and response variability. Genetic markers play a critical role in predicting individual patient response to platelet transfusions, which can vary significantly based on genetic factors. Genetic markers analysis enables the tailoring of platelet transfusions for each patient's unique genetic profile. By identifying genetic markers linked to platelet refractoriness or increased transfusion efficiency, we can develop personalized transfusion strategies. Personalized transfusions based on genetic markers can significantly improve patient recovery, reduce transfusion requirements, and minimize adverse effects. Genetic marker analysis aligns with the principles of precision medicine, where treatment decisions are customized for individual patients. It shifts transfusion medicine towards a more patient-centered approach, optimizing the use of healthcare resources and improves patient outcomes. Continuing research in genetic marker analysis may uncover new markers and refine existing ones, leading to an even more precise personalized transfusion strategy. The integration of genetic markers into clinical practice has the potential of revolutionizing transfusion medicine, benefiting patients with rare blood disorders. In summary, genetic marker analysis is a critical component of our research as it provides the foundation for personalized platelet transfusion strategies. This approach has the potential to improve transfusion outcomes and enhance patient care in the context of rare blood disorders. Our research on personalized platelets has far-reaching implications for healthcare and transfusion medicine beyond the scope of rare blood disorders. The findings have the potential to revolutionize the way platelet transfusions are administered and optimized for a wide range of patients. One of the most significant impacts of our research is the ability to create tailored treatment plans for patients with rare blood disorders. Personalized platelet transfusion strategies guided by genetic markers and platelet function testing can enhance the effectiveness of treatment and minimize adverse events. By optimizing platelet transfusion strategies, our research can lead to cost savings in healthcare system. Tailored treatments can reduce the need for excessive transfusions, shorter hospital stays, and fewer complications, resulting in overall lower health expenditures. Ultimately, our research aims to improve patient outcome by enhancing platelet recovery after transfusion, reducing the frequency and the volume of transfusions required, minimizing adverse events associated with platelet transfusions. Our work aligns with the principle of precision medicine, where treatments are tailored to the individual patient's profile. It signifies a shift from one-size-fits-all approach to a patient-centered model of care. Our findings contribute to the advancement of transfusion medicine, offering new insights to platelet transfusion refractoriness and the response variability. This knowledge may be applicable to a broader range of medical conditions requiring transfusions. In summary, our research has the potential to impact healthcare by improving treatment outcomes, reducing cost, and advancing the field of transfusion medicine. By tailoring platelet transfusions to individuals' patients' needs, we aim to provide a more effective and efficient care for our patients with rare blood disorders, while laying the groundwork for personalized medicine and safe transfusion therapy. Our research focuses on personal platelet transfusions for patients with rare blood disorders. We have explored the significant genetic markers and platelet function testing in tailoring transfusion strategies. The expected outcomes include advanced platelet recovery, reduced transfusion requirement, and improved clinical response. To optimize platelet transfusions for individual patients, to reduce the adverse effects and healthcare costs associated with transfusions, to contribute to the broader field of transfusion medicine and precision medicine. In conclusion, our research seeks to transform the way platelet transfusions are administered, making them more effective, efficient, and patient-centered. By harnessing the power of genetic markers and platelet function testing, we aim to improve the lives of patients with rare blood disorders and pave the way for personalized medicine and transfusion therapy. Long-term monitoring of patients to assess the sustainability of improved transfusion outcomes. Exploring the use of emerging technologies such as CRISPR-based genetic modifications to enhance platelet compatibility. Investigating the cost-effectiveness and scalability of personalized platelet transfusion strategies. Expanding research to include broader range of rare blood disorders and diverse patient population. Collaborating with other universities to establish standardization protocols for personal platelet transfusions. The future of research in personalized platelet transfusions holds exciting possibilities. We will continue to explore these areas, which will further refine and expand our understanding of how to tailor transfusion therapies to individual patients, ultimately leading to improved healthcare outcomes and enhance the quality of life for those patients with rare blood disorders. Thank you for your attention. I am now open to any questions and welcome discussions on personalized platelet transfusions, genetic markers, and any related topics. Please feel free to ask questions or share your thoughts. I appreciate your participation and engagement in today's presentation. If you have any further questions or would like more information about this research, please don't hesitate to contact me. Your interest and feedback are highly valuable. Thank you once again for your time and attention.